to over 2,000 patients. That's hydrocephalus and spinal bifida combined. That's 2,000, over 2,000 yearly. You understand? So that's roughly the estimate of the number of patients we've been handling. You realize that we've been looking at one of the most recent statistics. Over 6,000 babies in Uganda are born with hydrocephalus and spinal bifida every year. You understand? So Cure is contributing such a significant effort towards helping with these numbers, and that's why we need a couple of sponsors and partners to help us try to make these children live a better life. We're offering surgeries, we're offering rehabilitation services, we're offering support in whichever way. You understand? So that's the number, been around 2,000 every year. Yeah, it was a simple task to just try to explain what hydrocephalus and spinal bifida means. I'll start with hydrocephalus. It means hydrocephalus basically means water in the brain. That's a Greek term. You understand? But the main point is abnormal amounts of water in the brain. This could be as a result of multiple causes. A child could be born with hydrocephalus, or he could acquire hydrocephalus when he's already out of the mother's womb. So at Cure we have basically two categorizations. Those ones which are caused by non-infectious causes, then those ones which come as a result of infections, which is actually the majority of the patients we deal with. Over 70% of patients who come to Cure Hospital with hydrocephalus do so because they've had a prior infection, especially when they are younger. You understand? Yeah, so when they come to us, we do initial assessments and investigate, work them up, and we offer surgery. That's the most important thing. And the surgeries are usually very expensive. But it is made possible by generous contribution of people like you who come around and join us in the fight to make these children better. So basically, if you have hydrocephalus, they'll either open a way for the water, another way for the water inside the brain, or they may place the shunt. The shunt drains the water from the head to the tummy. The way for the water is kind of a modern technology that is still new, just been discovered recently by a former doctor who was working at Cure Children's Hospital of Uganda, and it involves going with a camera inside the brain to open another way for the water. So with that, with either method, you expect the much water to leave the child's brain. The water causes so much pressure on the child's brain. So if the water leaves the brain, the child gets a lot of relief. The brain starts to function, they start to grow normally. You understand? So that's briefly about hydrocephalus. I'll talk briefly about spinal bifida. We've probably gotten in touch to see babies who come around and they have swellings on the back. It's usually in the lower back commonly, and that happens. It's a problem that originates right before the child is even recognizable. You understand? The child is still around a few months old. There are bones on the back that eventually fuse over time. So if a child grows up and those bones don't fuse normally, you have a gap. Ideally, you're not supposed to have that gap. You understand? So when that gap forms, you expect the neural tissues, part of the continuation of the brain, down on the back, it's called the spinal cord, might protrude, might come out of the hole. And that causes a lot of, it carries a lot of consequences. When the spinal cord comes out of the hole, the nervous tissue that comes out might get constricted, and the child gets problems with containing urine, containing stool, and might develop weakness in the lower limbs, or they get deformities in the legs. So majority of the patients who come to us at Cure have those complications. Like I said, the most important thing for a child with spina bifida is trying to close that defect immediately the child is born. In developed countries, they have methods. They've kind of a little bit gotten advanced. They're able to close these things when the child is still in the mother's womb. So for us here, it's something we're hoping we might also be able to do in the near future. But for us, the most important thing is that the child comes out like this immediately. They seek care and the back is closed immediately because we don't want more damage to the nerves, kind of limiting those complications if you close them early, especially infections, because you have an open back. Sometimes they're ulcerated, you have wounds on the swelling. So germs can take that opportunity and they get to the child's brain and they cause infection that can impair the child's development eventually. So the most important thing is closing the back immediately. Usually we emphasize the first 48 hours of life, and you've done so well. I think we've been having a lot of community outreaches within Mbale and in the distant areas. We're trying to educate health workers to get these children early to the hospital. Because if you close it early, chances of an infection is very low. And the child grows on to become, grows on normally. Infections really cause significant damage on the child's brain, and the impact is huge, you understand? Because if the child has a damaged brain, the child is going to be dependent on the parents. The child might never grow up to achieve the potentials that they could have had if the swelling, the defect was closed early. So that's basically about spina bifida and hydrocephalus with a narrow or absent way for the water. So those ones, scientists are working around the clock trying to work out what causes such kind of an hydrocephalus, but they've not been able to specifically identify one risk factor or something you could do to prevent a child being born with hydrocephalus. However, the other category of patients who have hydrocephalus secondary to an infection. So this infection could be intrauterine, like a mother could have an infection, something the government has been working on quite well, trying to give vaccinations for some of the intrauterine infections, because these infections can actually get to the baby and damage the structures in the brain that absorb the water. So the child is born with hydrocephalus. Then for these ones who are born and they get infections, like maybe in the early days of life, I think that's all about the hygienic activities surrounding birth. The way the midwife cuts the cord when the child is born, and also a couple of our babies are still born from home. You understand? They are those traditional birth attendants who sometimes are more trusted than the health facilities. So the mothers prefer them, but the way they cut the cord and some of the practices they demonstrate predispose these children to early infections. And because the children, the kids are, their immunity is quite low, the possibility that the infection getting to the brain is quite high. You understand? So that's how they end up. When the infection gets to the brain, they damage the structures that absorb water, or they block water pathways, so the children end up with hydrocephalus. So that one we can work around it. We're trying to get in touch with the hospitals, with the training schools, and trying to educate people on how to handle children when they're born in a very hygienic way. That one we can play a significant role. Try to get in the community, teach the traditional birth attendants how they handle babies when they are born. Until we intend to get as many partners as possible to come around and make these children have a bigger dream in the future. Thank you so much.
To the Cure Brain Surgery Run to support the vulnerable children that we take care of at Cure. As Dr. Emmanuel mentioned, these children, if they don't get the medical intervention on time, they will be affected greatly. Some of them even die. We've also noted that most of these children come from very struggling families financially, and Talking about the cost of neurosurgery, most of us know how much it costs to go out of the country to go and get brain surgery done for them. But we thank God for cure, that we are able to do these surgeries here at Cure Children's Hospital in Mbale and be able to give these children another chance to live. To do this is not cheap. We are not a profit organization. We are doing this as charity. So we realize that we don't have obvious sources of funding other than the donations from well-wishers and friends like you and people from Uganda and outside Uganda, every day sparing a penny and choosing to contribute to this cause, to give these children a chance to live. So as Cure Children's Hospital of Uganda, every year we do the Cure Brain Surgery Run as a local initiative to raise resources and also to increase awareness of this condition. And through these resources, we are able to provide a holistic care to these children. We are able to provide a quality brain surgery to these children. We do not turn away patients, and so all these patients get this service fully sponsored. Their care is sponsored, their stay in the hospital is sponsored, the investigations, the labs, the scans, all that is sponsored, and even the post-surgical care is sponsored. I mean the follow-up treatment that they require. Some of these children require life medication. They live on medication to support them to keep away challenges or conditions like seizures, and the hospital is able to support these children due to the generosity from all well-wishers, including yourselves. So we appeal to you and call upon you to join us on this noble cause, the Cure Brain Surgery Run, which is happening on the 18th of October at Cure Children's Hospital. You can contribute by humbly buying a run kit at 30,000 shillings. You can also contribute as an individual in a bigger way. You can also contribute as a corporate sponsor. In this way, we are able to bring life to these children. There are many runs, but this is a unique one. You can choose to run and run to save a life. Thank you very much.